National Professional Officer for Tuberculosis for the World Health Organization (WHO) in the Southeast region, Dr. Ifeoma Adu, says that tuberculosis treatment coverage in Anambra State stood at 95%, which is one of the best in Nigeria. Dr. Adu made this known during a two-day training of doctors, nurses, and other healthcare workers on the clinical and pragmatic management of childhood tuberculosis organized by the Anambra State Tuberculosis and Leprosy Program, Control in Oka. Health correspondent Chibuzo Okoye completes the story.
Lectured during the training, Dr. Adu explained that they want to support and capacitated healthcare workers to better identify children that have TB, and that Anambra is doing extremely well in TB case findings, which stood at 95%, but noted that the state has not done better in identifying tuberculosis in children. The WHO officer who commended the Anambra state government for organizing the training, which he said is critical in identifying children with TB, urged participants to go back to their facilities and begin to identify and screen any suspected child with the symptoms of TB, like weight loss, unexplained fever, night sweat, consistent cough for over 2 weeks, among others.
This is a training where we want to see how we can support and capacitate healthcare workers to better identify children that have TB. Anambra State, for example, is doing well in TB case finding. The treatment coverage of Anambra State currently at about 95%, which is one of the best in the country. But in the area of identifying TB in children, they are not still doing so well. So in adults, they are picking lots of cases, but children are being missed.
Also in her lecture, Dr. Ifeoma Angelita from the Department of Community Medicine, Chukwemeka Odumegwu University Teaching Hospital, Oka, said that the essence of the training was to bring up to speed the TB focal persons in the various healthcare facilities in the state on the issue of childhood TB management. Dr. Angelita pointed out that most of the patients receiving TB medicines in the various facilities in the state are adults, and that the adults have children around them, which puts the children at risk of contracting the disease. Hence, the imperativeness of the training.
The sense of this training is to bring the DOTS focal persons, that's the TB focal persons in various health facilities in Anambra State, to bring them up to speed on the issue of childhood TB management.
According to the university don, the training would, apart from teaching the participants the basic things they need to know and do in the management of TB cases in children, will also teach them those signs they need to see in a child that will make such a child a suspect and be diagnosed immediately in order for him or her to be placed on treatment. The training featured questions and answers in Oka. This is Chibuzo Okoye for ABS News.